Jose Gutierrez was 88 when he passed away on April 19th. He'd been at Brooklyn's Cobble Hill Health Center since late January. Diabetic, blind in one eye, unable to take care of himself at home. He lost his life like so many other Americans not long after nursing homes stopped all non-essential visits, including by relatives, as overwhelmed facilities tried to keep the virus out and admittedly struggled to keep families informed about how their frail and vulnerable relatives were doing. The grieving Gutierrez family now struggling with unanswered questions about his death.
We was trying to inquire about his health, and, they was giving us the runaround.
Joey Gutierrez and wife Ellie said they only learned of his father's death when they called the nursing home worried, just days after state records showed Cobble Hill Health Center, at the time, had the most reported presumed deaths due to COVID-19 of any nursing home in New York State. Gutierrez had not been able to see his father for a month because of the mid-March federal mandate banning non-essential visits to nursing homes. How do you feel now that you weren't able to be there with him at the end?
Horrible. You feel like you failed your parent, I never wanted to feel that way, ever. It's a tough thing because I have to sleep at night thinking about this thing that I failed my father. I think people don't understand that.
Gutierrez says a doctor first told him 6 days before his father's death that he had an upper respiratory infection, was on an IV because of dehydration, and that the nursing home did not have tests for COVID-19. Over the next few days, Gutierrez says his family could not get any more information.
We was inquiring a lot about it because if he was ill, I wanted to take him to the hospital. I didn't want to leave him there because I believed they had the capability to take him, especially after they told you they don't test over there.
Cobble Hill Health Center would not comment on the Gutierrez family's allegations and declined an NBC News request for an interview, citing privacy concerns, but sent us several emails nursing home officials sent to New York State health officials from late March to mid-April asking for help, saying that they were in dire need of PPE, especially gowns and face masks, that over 50 COVID symptomatic patients were there, and we don't have the ability to cohort, meaning separate them, based on staffing. And on April 9th, a request to send sick patients to emergency hospitals like the Navy ship USNS Comfort and the Javits Convention Center, a request that was turned down. A day after Gutierrez's death, and with Cobble Hill in the headlines because so many residents had died there, CEO Donnie Tuckman expressed his frustration to a crowd of supportive neighbors.
At the state, there's no one. Right here, we're doing it alone. We're doing it alone. So these people are deserving of everything that there is in the world. These people right here.
In a statement, New York health officials say we were responsive to Cobble Hill, offering help with staffing and PPE, and that the emergency hospitals were not suitable for nursing home residents due to their specific care needs. The nursing home also posted letters to families on its website, saying after the mid-March ban on visits, the facility tried to put in place a robust system, contacting each family twice a week with updates, while admitting, despite our best intentions to communicate with you, we recognize that mistakes were likely made along the way. The most recent letter, April 30th, says the nursing home is now testing, has a dedicated COVID unit, that under 25 residents remain sick and over 60 have recovered. All of that little comfort to the Gutierrez family, who, like many families now, had to settle for a socially distanced funeral.
It's demoralizing.
40-minute max.
I understand the magnitude. It's just like you're getting kicked when you're down already,
The family creating a digital memorial.
Gramps, I will always remember your life lessons.
Brooklyn will never be the same without you and Grandma.
I just wanted to say that I love and miss you so much.
I am forever grateful for your love and your wisdom.
Until we meet again.
Like so many families who've lost loved ones in nursing homes, struggling.
He didn't deserve to die that way. Nobody should they could have done better over there.
Ron joins me live now. Ron, just an absolutely heartbreaking story there. We said off the top, nearly 5,000 people have died in New York nursing homes. That is a devastating number, but it is likely even higher. Why is that?
It's about 25% of all the deaths due to COVID in New York State, and it could go higher, yes. Some of this is reporting. Remember, this is all new, nursing homes reporting deaths, and there's been a demand that they be more transparent in the age of COVID, mainly because people don't know what's going on inside. Remember, these are, for the most part, private businesses. This Cobble Hill is a nonprofit, but they're private businesses, and the federal government, the state government's position has been, there are regulations that you have to follow. Take care of your residents, and if you can't tell us, and we will take them someplace else, which of course means the facility loses money. So it's a very complicated situation, but the bottom line is that there's a demand for more transparency, that people know what's going on. Nursing homes now have to report when they have COVID-positive patients, when patients die, so families know and can make informed decisions. I should point out that behind me, the Bellevue here, it's shift change here, and there are a number of neighbors from the community here who are ringing that bell to support the staff. And there's also that white tent back there. They're giving away care packages, food to support the staff. They've been very supportive. They feel like the nursing home has been doing the best it can under very difficult circumstances. And again, it's a very, very complicated, multidimensional problem. Allison?
Ron, Governor Cuomo says the state is investigating outbreaks in nursing homes. Have the homes responded at all? What are they saying about this?
Well, these investigations are getting underway. I think the main thing at this point, though, is to try and get these nursing homes the equipment that they need, the PPE that they need, the staffing support that they need to try and get past this crisis. There's a call for more inspections. There's a call for investigations. I think the investigations are going to have to wait for a minute because they're trying to essentially put out a raging fire that's happening in these facilities. That's the priority. Again, a lot of finger pointing, a lot of blame to go around. But at this point, the numbers are still going up. The crisis is still happening at these facilities, and there seems to be no solution at the moment in sight. Allison?
Ron, before you go, how about the Gutierrez family that you shared with us, their story in that story that we just saw? What is next for them?
Well, I think they're still grieving. They're still mourning. Jose Gutierrez was the patriarch of the family, 5 children, 10 grandchildren, 12 great-grandchildren, if I got the numbers right. So they are just devastated. I would imagine they are contemplating legal action. I don't know any particulars about that. But again, they are in a situation that so many other families are in because of this federal mandate that shut down nursing home visits, and that's still in place. It's been since mid-March, so we're getting up to almost 2 months where people have not been able to see their loved ones in these long-term care facilities. It's designed, of course, to keep infections and the virus out. But in the absence of that information, and remember, these are people who, for the most part, see their loved one every day or many days in the past, and now not for 2 months. It's a very difficult situation. And, the Gutierrez family, we wish them thoughts and prayers of the best. I think they're just trying to get through each day and take it one day at a time.
Yeah. Yeah, absolutely heartbreaking, Ron. And as you said, we offer our thoughts and prayers. I know that doesn't change anything or make it better, but your heart just breaks for all of these families that are going through this. Ron Allen, thank you so much. They've already reported thousands of deaths. Now, nursing homes across the country want protection from a potential wave of liability lawsuits. MSNBC legal analyst Danny Savalos joins me now. And Danny, first off, what kinds of claims are these nursing homes likely up against? And what is their argument here for legal protection?
First, the kinds of claims they'd be looking at are essentially negligence claims, that the nursing home breached a duty of care, a standard of care, and that breach caused damages. Now, there's already a challenge in any kind of COVID-19 lawsuit because under traditional negligence principles, you have to show that the negligent act caused the injury. And there's going to be a challenge in showing that even though there was a negligent act and somebody contracted COVID, that those two are connected, that there's a nexus between the two. Because the defendant nursing home is just as easily going to be able to show that either they could have gotten this from visitors who came in, and in that case, it might have been inevitable, or staff coming in, or they might have gotten it some other way. It's a tougher climb with nursing home residents because they live there. They may not leave as often as other people might. But the nursing homes here are asking for immunity for at least negligence. Now, states are responding by giving, at least some states are, by giving immunity for regular negligence. But in the law, we have something beyond that, a category of culpability called gross negligence or recklessness or even intentional acts. And the major line dividing there is that the conduct is taken knowing on some level, either intentionally or knowing that what you're doing is wrong or risky.
Danny, are any states offering legal protection right now, working with the nursing homes on this?
Yes, several, including New York, and usually by way of executive order. And while they vary somewhat, generally speaking, they immunize nursing homes from general negligence. And the difference between negligence and recklessness is usually the difference between someone saying, oops, because they weren't aware what they were doing was wrong. And recklessness is like saying yeehaw, knowing that I know what I'm doing is wrong. I'm speeding. I'm doing 90 miles an hour in a 60-mile-an-hour zone, and I don't care. I'm doing it anyway. The kind of negligence, this kind of gross negligence or extreme negligence that would qualify might be if the nursing home does something and conceals what it does to save money or cut corners and reuses materials that they know to be contaminated. But those are just hypotheticals. And ultimately, the challenge here is defining what is the standard of care in a COVID era when we know that it's arguable the virus is everywhere.
Danny, we know that several states are still refusing to release data on the nursing home outbreaks. They are citing privacy laws. In Arizona, the media is suing the state's Department of Health Services to release information on those outbreaks. What's going on there?
It's a tricky issue anytime you're suing for public release of information that may be protected by HIPAA and other federal laws that create really stringent punishments on providers that even inadvertently, accidentally release this information. When it comes to HIPAA and information surrounding HIPAA, and I know this as an attorney who has to go get medical records from time to time, it is not the same as requesting public release of some other government record that would otherwise be subject to release. Even though the government may ultimately be forced to reveal this information or release it, because it involves medical records, I'm not surprised that there's some pushback, and it may take longer than normal in government records requests.
Danny, on the flip side, how about families who want to pursue legal action? Ron Allen just talked to us about a family here in New York who had to call a nursing home to find out if their loved one was still alive. We have heard this story more than once during this pandemic. If there are families who want to pursue legal action, what hurdles are they up against?
There are causes of action for recklessly or even intentionally causing emotional distress, and that could qualify if you mishandle information about a loved one's death or their very serious situation. But that's usually a very difficult case to make out, especially in New York, which has issued an order protecting these nursing homes from ordinary negligence. Attorneys will have to plead something more serious than ordinary negligence and get into that realm of recklessness or wanton misconduct, and really anything that goes beyond, just accidental negligence. I didn't know what I was doing was wrong, but I fell below the standard of care, into, I knew the standard of care and I violated it, or I defrauded people, or I acted recklessly knowing that there was substantial likelihood of harm resulting from my conduct.
Danny Savalas, a heavy topic, devastating for all of these families who have loved ones in these nursing homes. But thank you so much for bringing us the legal perspective here. You always help clear up things that can be confusing for those of us who aren't lawyers. Grateful to have you always.
Thank you, Ellison.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.